Hi, everyone. Thank you so much for joining us tonight. My name is Alicia. I'm a recruitment coordinator here at the University of New England, and I'm joined by my colleague Cassandra, which will do introductions in just a second. But thank you so much for joining us for this UNE D.M.D application walkthrough. And without further ado, we'll just go ahead and get started. Um, if you have any questions throughout, you can drop it in the Q&A, and we'll get to it at the end. But so like I said, my name is Alicia. I work here in the Office of Graduate Admissions with my colleague Cassandra.
Hi, everyone. My name is Cassandra. Thank you for being here. I am an admissions counselor in our Office of Graduate Admissions, and I work primarily with our Doctor of Dental Medicine program. So I'm very excited to talk about that with you today.
So just a quick overview of this session this afternoon. So we're going to talk through some important application dates and cycle dates to keep in mind, some admissions requirements for the D.M.D program here at UNE, talk about some recommendations, and then we'll go into a good portion of Q&A at the end. So we do have a few pre-submitted questions, but again, just to reiterate, if you think of any throughout the presentation, please use that Q&A function that you'll find down below. So, a little bit about UNE as an institution and our Portland campus here in Maine. We are the #1 provider for health professions in Maine. So, UNE is committed to educate health leaders who make a difference for their patients and their communities, and that's across all of our graduate health programs. So, as a student here on the Portland campus, you will be learning alongside your colleagues in dental hygiene, nursing, osteopathic medicine, occupational therapy, physical therapy, physician assistant students, and pharmacy students. So it really is a sort of interprofessional hub that we have going on here. And this is just a quick little visual of where we're located in Maine. So we actually do have two campuses relatively close to each other. So the Portland campus, which you would be studying at if you were to be in our D.M.D program. And we also have our Biddeford campus, which is primarily our undergraduate campus. So they're about 30 minutes apart. It's a pretty easy drive. And you do have access to all the amenities that the Biddeford campus has, in addition to the Portland campus as well. So it's also really conveniently located from Boston. So if you're ever have a weekend where you want to sort of take a break from studying, go see a concert or something in the city, you can easily drive there. It's about a 2-hour drive, or you can also take the train, which is super easy too. So you don't have to worry about parking or anything like that. And this is sort of an overview shot of our Biddeford campus. So, like I mentioned, you will have access to this campus as a student here. It's nice and waterfront. It has its own beach on the Biddeford campus, which is really cool. Um, there's a really nice athletics facility down here. We do have like sports management, and our Master of Science in Athletic Training program is on this campus. So some really nice facilities, a pool, ice hockey rink, all of the above. So this is a really nice campus, again, about 30 minutes away from the Portland campus. And here's an aerial shot of the campus that you would be spending time on. So again, pretty close to the water, close to the sort of Back Bay area. We are pretty close, about like 10 minutes away from downtown Portland. So you'll see a photo of downtown on the next slide, but tons and tons of restaurants, things to do. Just it's really, really nice. So I guess I can. Oh no, the picture's not on this one. Well, anyway, a little bit more about downtown Portland. It's really nice, really a foodie city, a nice small city. Cassandra, I don't know if you want to say anything else about Portland before we go into more about the D.M.D program, but I will hand it over to you.
Yeah, sure. I would just quickly add that it's a really good mid-size or smaller city that has that old charm and the cobblestone streets, and there really is something for anyone, whether it's going to coffee shops, eating, just looking at different shops. I personally like shopping and getting coffee. Concerts, whatever you like to do, there will be something for you. And then in Maine where we're located, you're also very close to the outdoors, whether it's skiing or going to the beach or any sort of outdoor activity. You have that as well. But yeah, I'm going to talk a little bit about our College of Dental Medicine here at University of New England. So I kind of want to talk a little bit about the program, and then I can go into some more specifics about deadlines and what to expect in an application cycle. So our Doctor of Dental Medicine program has a mission to improve the health of specifically of Northern New England, as well as rural and underserved communities, while also, having a public health emphasis and shaping the future of dentistry through excellence in education and discovery, as well as service. So we are the only D.M.D program in Northern New England. So that's Maine, New Hampshire, Vermont. And we really like to pride ourselves on having early access to simulation as well as integrated didactic learning. We also will begin a group practice clinical model where at the beginning of your second year, you'll actually be placed into a group with other D2, D3, and D4 students, and you will work together in our on-campus oral health center with patients. We also have diverse clinical rotations in the Northern New England as well as Boston and Rhode Island area that you'll get to work with. And also, we're very big on interprofessional learning, as you may have gathered so far with all of the other graduate health professions programs we have on campus. You do get opportunities through simulation labs and different courses that you'll be through that you'll be getting to work alongside and learning with and others, whether they're in your program or a different one, to see what is the scope of practice that you are doing and how does that what is someone else doing in their profession and how do you come together and work with the patient. We also have lots of service opportunities as a university, as well as a relatively small class size of 70. And everything on this campus is very focused on graduate services. So any student support services will all be geared toward you as a graduate student. But I want to talk about some different areas and what exactly does UNE look for in our applicants. So one thing that's very important is leadership skills and a potential for leadership, as well as a community-based focus or a commitment to service. Of course, we're looking at your grades, test scores, and coursework, and things of that nature. But where we are a very collaborative group practice-based model program, it's very important to see those who have a collaborative nature and who can succeed in working with a team and in a group work setting. And other important aspects is a care for others, as well as emotional intelligence, cultural competence, the excitement for the chosen profession, really being able to understand UNE's mission and understanding of dentistry itself and why dentistry as opposed to another health profession and why UNE specifically. And again, like that last point, just being aligned with our college or program mission. All right, so as of a couple days ago, the 26-27 cycle in ADIA ADSAS officially opened up. So I can't believe we're talking about 27 already. But this June 2nd of 2026 will be the first day where you're able to submit your ADIA ADSAS application. And November 1st is UNE's application verify deadline. This means that your application has to be submitted and verified through ADIA ADSAS before we receive it. So it's important to plan ahead of time and submit earlier to ensure the verification process. And I did just want to make a note about that October 1st deadline. That is the deadline for you to take your DAT for the first time. So our prerequisite coursework is all listed here. The one that I would like to talk a little bit more about is the anatomy requirement. So there are a few ways that you can complete the anatomy with lab prerequisite. So it's really the anatomy portion that's important. Physiology is a recommended course, but in this instance, it's the anatomy portion that we look at. So you can either fulfill this by taking an anatomy course with lab worth 4 semester credits, or if your university does anatomy and physiology, you would need to take both anatomy and physiology 1 and 2, both with labs, to complete that full sequence of anatomy content. So all prerequisite coursework must be completed with a grade of C or above. And you're very strongly encouraged to indicate any coursework that's planned or in progress when you do submit your application, as it's just helpful for planning purposes. So we know, is that class there? Do you have a plan to take it, etc. So you can have coursework in progress when you submit your application, but all prerequisite coursework must be completed by June 1st of 2027. So some recommended coursework that can be helpful to note is physiology and immunology, and any other course as listed in front of me. Another thing that I always like to point out is any sort of 3D art or sculpture may not be what many people think of, but just to that point, making sure that you have good examples of your manual dexterity, whether it's a hobby or sculpture or art or knitting or crocheting, something where you could show that manual dexterity will be important to add in your application, as that is a question that they look at. So some important elements of an application include your transcripts, your letters of evaluation, your DAT score, and your shadowing. So I just want to go through some of those. So transcripts must be submitted directly through ADIA ADSAS. Final transcripts from all colleges, universities that you've attended, even if it was just one single course, will be required. So that will all go through ADIA ADSAS directly. And this is where you would send your transcripts. So we require at least 2 letters of evaluation that must be submitted again directly via ADIA ADSAS. One letter must come from a science instructor that you've taken a course with. And the second reference can be from a dentist that you shadow, a professional reference, or other academic reference. If you have a committee letter, that can stand in place of the 2 required letters. And it really is highly encouraged that your letters are dated within the recent 3 years to show, your skills and qualities as of more recently. So letters should be requested from those who really can speak to your academic ability and professional experiences. So when thinking about who you would like to write your letter, it's very important to even maybe sit down with them and kind of have a conversation and say, here are some areas that I think are important to highlight. Maybe you were really good in a group project with, one faculty member or one letter writer, and you want to focus on that in one. Some areas to highlight and focus on are those letters would be your adaptability, conflict resolution, empathy, your oral and written communication, your relations, self-awareness, exposure to the profession, etc. So I mentioned this earlier, but all applicants must take the DAT for the first time on or before October 1st. And so those scores will be officially sent to ADIA ADSAS. We will accept scores and consider those after October 1st if you've already taken it before. And any score is good for 5 years. Applicants are also required to complete a minimum of 30 hours of in-person dental shadowing or experience. So this can be dental hygiene, dental assisting, or shadowing. So a complete application would include your 2 letters of recommendation, your official DAT score report, as well as your minimum of 30 hours of your dental experience reported. If you are an international student or if you've completed your coursework outside of the US and any English-speaking Canadian institution, you will have to provide a official WES evaluation, which is a course-by-course evaluation, translating your credits to the equivalency of a US transcript. So after submitting your application, it's important to keep track of your progress of your application. So because we do look at the verified application, ADIA ADSAS does not reach out directly to you if you're missing an item. So it's very important to track it on your end to see whether it's been received, whether it's been verified. So that way we in our office will be aware of your application because we don't get it until it is in that verified status. So if you're ever unsure of your verification status, please feel free to reach out to our Office of Graduate Admissions, and we can reach out to you regarding any missing or incomplete items. And also just another note, sorry if you go back a second. Also, just there are ADIA Access academic update periods throughout the cycle, which are great to take advantage of. I believe the first one is in August, and then there is one in December after a fall term is ended. So if you're currently taking coursework, getting those final grades in, you can go and update that. It'll update, your GPA and everything. Definitely take your time with, filling all this information out. And you can also update your experiences as well. It can be a long cycle, and so it's always important to keep everything as up to date as possible. So once we receive your verified application, we'll do a preliminary review in our office to make sure we have all of those checklist items to be considered a complete application. Once your application is complete, your complete verified application will be sent a supplemental application fee. So once we receive payment for this, your application will go and be continued in extensive review by the admissions committee. Interviews are another required part of the application process, and they're conducted by invitation only. Our Office of Graduate Admissions will communicate interview invitations to qualified applicants. And for the 26-27 application cycle, interviews will be completed virtually through the Kira Talent platform. Per the ADIA ADSAS traffic guidelines, the initial acceptance date will be December 15th, 2026. So no one will hear anything before that date. And then after December 15th, decisions will be rolling from then.
All right, so a quick little plug here for anyone who is interested in additional virtual events that we hold sort of throughout the cycle. As we get further into the cycle, we will start to hold more virtual events based on like specific topics and things like that. So if you're interested in that or you're interested in coming to campus, visiting for a campus tour, you can go to une.edu/grad visit to get that set up. And if you do go online and for some reason there isn't a date available for you offered by us that would work with your schedule, you can always reach out to Cassandra and we'll work to get something set up for you. And finally, here is some information for you to reach out. So you have Cassandra's direct email right here, and then also the sort of general inbox for our office, which is gradadmissions@une.edu. So a lot of times if you reach out to that grad admissions inbox, it sort of ensures that you're getting a timely response in case Cassandra is out on vacation or something. It gets sort of filtered that way. And you can always call us as well. And then we also recommend go ahead and following the UNE CDM on Instagram to sort of keep up to date with what they have going on, what their students have going on, and those sort of things. So now we'll go ahead and get into the Q&A. I did see some coming in during that presentation. I will just start off by saying if you have any specific questions about like your own specific prerequisites, for example, or your own very like specific experience, definitely reach out to Cassandra via email to get those things sort of sorted out. We'll use this time to stick to sort of like general questions about the application process and more about the program. So let's see. Sorry, the first one's kind of long. So can you, to sort of narrow it down, can you speak a little bit to if someone submits like a committee letter versus multiple evaluation letters, does that impact their application in any way?
It does not. So ADIA ADSAS will the maximum limit that you can submit is four. There's four slots. And so it's really important to obviously at least have the two required, but it really is important to think quality over quantity. So whether you have one committee letter that has a few different members writing for you, or whether you have three different separate letters, it really is more about, of course, do you have the one from the science faculty member, and do you have letters that can really speak to you and provide us a great understanding of some of those qualities and aspects and how you would align with our university.
Um, what are some of the different service opportunities that are offered at UNE, or maybe specifically within UNE's CDM?
Yeah, so we have a lot each semester. So some are more general to UNE in general, and so you can do different. So this semester, we actually had different service learning opportunities at a local housing authority in a nearby town where you would go and have weekly meals and play board games. Another opportunity was working at the local Cumberland County Jail, which is our county where Portland is. But D.M.D specifically, we do a lot of work with the community. We do Give Kids a Smile Day each year where elementary, kindergarten, and young school children from a local area will come in for the day, and you'll get to do their cleanings, do sealants, provide dental education, and work with a lot of students who may not have had the opportunity to go to the dentist regularly. And how do you work with that patient population, which may be very different from working with a 30 or 40, 50-year-old? How do you work with then an 8-year-old, a 12-year-old? And so that's one aspect. We've also gone out in the past and handed out emergency medical kits and dental hygiene kits to people in the local community in the city. So we're always trying to be involved, whether we're bringing patients and people to campus or going out into the local Portland area.
Awesome. Um, is there any preference put on in-state or New England applicants versus out of state?
No, there's no preference. So we are a private institution, so we don't look at in-state, out-of-state any differently. It really is who you are as an applicant, and do you align with our values and our mission. And if we only looked at people from Maine and New England, we wouldn't have enough people for a class. So we really do value having a very diverse class based on experiences, where you're coming from, what you studied, etc. So we're very open to wherever you're from.
All right, next question. Do you recommend applying early, even if, for example, you have to retake the DAT?
So if you have a DAT, so a couple things. If you don't have a DAT score yet and you don't have a letter yet or whatever it may be, and you do submit an application, it will be held as incomplete until you receive those final items. So if you have not taken your DAT yet, you can submit, but it will just be in that holding status. If you already have a DAT score, for example, and you're looking to retake it, you can apply, and we just need those scores. And so it really is up to the applicant on whether they would prefer to wait a little bit and see if they, like their new scores better, or if they're okay with what they've taken and they just want to update us on those new scores in the future.
Um, Here's a good question. This person's asking if they plan to retake one undergrad class, but they're not sure where exactly what institution they're going to take it through or take it at. How would they enter that or communicate that on their ADSAS application?
Yeah, so in addition to sending your official transcripts through Adia Adsas, there is this transcript entry portion where you can actually go through and list and write out the courses that you're taking, whether you've taken, whether you're planning to, whether it's in progress. So you don't have to have the institution name figured out yet if you're not sure where you're taking the course. For example, you can go in there and write planned fall 2026 term, Bio 101, whatever it may be. And then that way we know that yes, there's a plan, or yes, it's in progress. And you can update us on more information during an academic update period once you do know where you are taking that class.
All right. This is a sort of fun question, a little bit outside of the application process, but what are some coffee shops that you recommend near campus?
Yeah, so we have a lot in Portland. There's so many, but we do have a few that are closer to campus. So we do have the chain restaurants like Dunkin', Starbucks right nearby and well, Dunkin's not walking distance, Starbucks is. But we also have cute cafes too that are local. A little bit down the street, there is a um, bakery, a little shop with ice cream and boba tea. There's also a coffee shop that's also a flower shop. And so you can go in, get a latte, and they also do bouquets of flowers. And that is down the street from campus. And then if you go about 10-minute drive into downtown Portland, there's a lot of different coffee shops everywhere. I personally really like Bard Coffee. They make their own, I have to say, I'm obsessed with coffee. So this is just my personal favorite that I go to. It's called Bard, Bard, and they make their own syrups in-house. They put like vanilla bean in their mocha flavor, and it's super good. So, and if you're a big food person at all, you'll find something here that you like.
Yeah, I pretty much would agree with you. Rambler is the coffee shop right down the street with the little flower bouquet bar. Their coffee's really good. It's in walking distance, super cute. So yeah, that was a great fun question. Um, let's see. So this question is asking what a WES evaluation is and if that's something required. Can you just talk a little bit more about what that is?
Oh, yes. Sorry, I was reading one of the Q&A. Could you repeat the question?
Yeah. Can you just
So many
talk
questions.
about
Yes.
or explain like what a WES evaluation is and
Yes.
specific
Yes. Of
circumstances?
course. Yes. So if you've taken coursework or you got your degree at any foreign institution outside of Canada in the US, then you would need to get a what we call a WES evaluation. So that is a World Education Service transcript. And so what they do is they take your transcripts from your university that you attended, and they will do a course by course breakdown of what courses you've taken, what grade you earned, how many credits it will equal, and then we'll receive that, and then we'll be able to have that translated into the US credit format.
Next question. Can you talk a little bit about how long the verification process can take for an application?
Yeah, so it does vary. So sometimes we've seen it in as little as 2 days. Other times it's gone up to 6 weeks. So when looking at an application deadline for anywhere, it's very important to not think, oh, I have until November 1st. I'm going to submit the day or two before, because oftentimes we'll receive that application after. Where we use that verification deadline, the application needs to be in the verified status on or by that deadline. So definitely kind of taking that into consideration and giving yourself ample time for that process to be completed.
If someone has a non-science major, but they have all of the prereqs completed, would you encourage them to apply? Are they able to apply?
Yeah, everyone is able to apply as long as you meet the requirements. You have your letters, you have your DAT score, you've completed the prerequisite coursework, or you have it in progress. So you don't necessarily have to have a specific major or area of study as long as you have completed at least those prerequisites.
All right. Um, so I'm going to ask you this next question, and maybe you can talk a little bit more about sort of like the interview process, specifically through Cura Talent. But how long after receiving an interview invitation do they have to complete the Cura interview assessment?
So the Kira interviews are asynchronous. And so when you receive an invitation to that, you'll typically be given a week to complete it. It takes about 30 minutes to complete in one setting, and you'll have a week to submit that. So there will be a welcome video and different questions provided by faculty and current students, and you'll be able to get those questions, think about your answer for a moment, and then you will record and submit those answers. And then they'll be reviewed by the admissions committee.
Awesome. Next question. Are applicants able to send in more than two letters of recommendation?
Yes, so the maximum allowed is four in a dia ATSAS. If you have a committee letter, that only takes up one space, so you still have three spaces left. If that makes sense. But yes, four is the allotment on a dia ATSAS.
All right. More of a sort of program specific, curriculum specific question. Do you know the student per instructor ratio?
Yes, so it's anywhere between, I believe, 6 to 1 or 7 to 1, depending on the specific class.
Awesome. Um, Here's another really good question. Um, do students struggle in finding patients during their clinical years?
So we provide patients to you, so you don't have to worry about trying to build up your patient base, as we have a very strong patient population and very strong need in this area for more dental care. So you can just worry about practicing your skills and treating patients and learning what you need to become a great dentist in the future, and patients will be provided to you. We do have our oral health center is open, I believe, 48 weeks out of the year, 5 days a week, basically like an 8 to 4, 9 to 5 schedule, essentially. And we even do have a couple slots a week for emergency urgent walk-ins. And sometimes you will see the line out the door at 7 a.m. waiting to get into those spots. So we do have a very strong need for more care in the area, which is great for you as a student because you're always going to be able to have practice and meet patients and be able to treat them. And it's great for our patients too, who are either local or even drive a couple hours, because we are providing reduced care, reduced cost care that many of our patients do not have dental insurance. And so it's a very beneficial mutual relationship between the main community and the students.
Does UNE view prerequisite coursework completed at a community college different from a different institution?
No. So we'll accept coursework as long as it's from a regionally accredited US institution or international equivalent. So that can include online coursework, coursework taken at your local community college, as well as university.
Um, Here is a question sort of about campus and the location of campus. For students who are maybe out of state or don't have their own car or transportation, can you speak a little bit about like if there's public transportation or what a lot of students do in that situation?
Yeah, there is a bus service in Portland. And there are a couple bus stops right on campus, which is great. So there's that. Um, and then there's a bus, the bus does go to like two nearby towns that are next to Portland. But I will say, in general, it kind of depends where you're looking to live. A lot of people will, there are some apartments in the area that are, a few minutes walking distance. Other people may live closer to the Biddeford area, which is about 30 minutes away, where our other campus is, and they'll commute on the highway. So there really is a range depending on how close you want to live, how far you're traveling, whether you want to walk, bike, look for public transportation, or bring your car with you.
Um, let's see here. Hmm. Another question going back to interviews. Um, are candidates able to come interview in person or only online?
So right now they are only online.
Awesome. Let's see. Another question around like letters of evaluation. Would a professor from a community college be able to satisfy one of those? Or does it have to be from like a different university?
Yeah, no, that's fine. As long as it's someone for the science instructor one, as long as it's someone who you've taken a science course with, who you've gotten a grade from, and that really can speak to all of your qualities, and that then that would be accepted. Yes.
And sort of shifting gears a little bit, can you talk about sort of how early students begin working in the clinic? Um, yeah, go from there.
Yeah, so very early. So week one, you get here as a first year and you are in our simulation clinic, our lab, where you will be working on your hand skills. You'll be given your set of tools. We also have the wet lab that you can, create the molds in. And so you're doing that your whole first year, you're spending primarily in our simulation lab as well as mixed along with your didactic coursework. So you do get that hands-on practice very early. And then starting at the beginning of your second year is when you'll be placed into a group practice clinical model with other D2, D3, and D4 students, and you will begin working with patients in our oral health center on campus. And so you will be, assisting and, doing what you're able to with patients that you've learned and are able to thus far. And then once you're in your third year, you really will be in the oral health center 3 days a week, treatment planning on the fourth. And then as a D4 student, you'll be in treating patients in our on campus oral health center 4 days a week, while you'll be working on those treatment plans, calling patients, etc., on day five. And then your fourth year, you also are able to do a 12-week externship, which are at community partnered areas at different sites in the community, typically in northern New England, but we also have some in Rhode Island and some in Boston. You definitely will do at least one. Some can do up to two. And so that's really a great opportunity that students always say and provide feedback that they really realize, like, yes, I have all these skills, and like, how is it different? How is the patient population different? What is the speed at which I'm practicing at somewhere that isn't on campus? And so really lots of opportunity to be involved from early on and very consistently throughout your education here.
So, thank you for that answer. That was great. Let's see here. Uh, does UNE have an advanced standing dentist track?
Yeah, so in the past, we do have a couple seats open for advanced standing track, and that is anyone who um, was a dentist in a different country and they want to become a dentist in the United States. Um, it kind of varies year to year if there is an open spot. So I would definitely reach out to us about the specifics each year about that.
Um, Next question, and then I'm going to try to switch to a question that maybe I can answer so you can you can take
Okay.
a break. Um, so if the application requires two letters of recommendation, but someone has requested four, to get that max four, say they have the two letters submitted, but they're still waiting on the other two, will their application be held until all four are received, or how would that work?
So you're only held if we don't receive the minimum required amount. So once we have those two that we need, your application can be continued review. If you are waiting on those letters, they will come in automatically to your application, and your application will be updated that way. And so then when your application is reviewed, then all of your letters would be there to see.
Awesome. All right. So next question, which I'll try to take a stab at and then you can add on. But is there an area where most DMD students typically live? So there are a lot of DMD students that I know of and have seen who live sort of on like some of the side streets to campus who I frequently see like walking to campus for class and things like that. But a lot of other students, not only DMD, but across all of our health programs, tend to live in Portland and then some like the surrounding sort of cities and towns. So I would say anywhere up to like 30 minutes from campus students tend to live. A lot of students will carpool with each other to get to campus. Um, Also, a lot of students will sort of be in contact with some of their classmates when For example, like in your D4 year, if one of your friends or peers is going on their externship, sometimes they'll let you like rent out their apartment while they're in a different state or vice versa. So there's a lot of different sort of opportunities that way. Um, but what is your take, Cassandra?
Yeah, it's similar to what you were saying. It really does depend on individuals' comfort level and where and how long they're used to traveling. Some people are used to driving 5 minutes and they want to be as nearby as possible. Others are used to driving 40 or 50 minutes to get somewhere sometimes. So living somewhere 20 minutes away is is pretty easy, straightforward. Just get on the highway and come to campus. So again, I think really any of the cities in the surrounding area are good places to look. It really does come down to, what type of housing accommodation you're looking for. Maybe you have to go further out if you're looking to get a house with a family. Maybe you're more in Portland if you're looking for more of a studio, 1, 2 bedroom apartment situation. So it really just does depend on what works best with you. But we do have students really living anywhere from the street across from campus to a 30-minute drive away.
All right. What makes an applicant stand out to the admissions committee?
So we really do value as a very mission driven university, we really do value those that have a commitment to service. And so being able to see any service hours, volunteer hours, any commitment to service is very valuable to have. The admissions committee really does like to see those who have empathy and are able to work in a group setting and where our mission is very focused on providing care to rural and underserved populations, especially throughout New England, it is important to see those students with those values. In addition to, of course, having, looking at your grades and coursework and test scores and everything like that, some of that, your personality and who you are as an applicant in some of those more qualitative manners is also very important. So that, and then really understanding the UNE D.M.D's, our College of Dental Medicine's mission and values. More than just a quick sentence about it, it's very important that you understand it and can speak to it in your own words. How do your experiences, if you feel like this is a mission that you really value, how do your experiences align with that? What have you learned from your experiences that could help shape you to be able to flourish on our campus? How does our curriculum and mission and values relate to you where you feel like that's how you want to, what do you want to be in a future provider and how does UNE, help you with that goal? So thinking about that and then again, just your reasoning for dentistry in general, it's very important to have a good grasp and knowledge of the profession. And again, sort of those qualities that you have, those values that you have for yourself, and tying it to our mission.
Yeah, that was a great answer and a pretty good segue sort of into the next question. So this person is really interested in the school's mission and learning more about community services. Does the College of Dental Medicine provide opportunity for students to work with patients with disabilities?
Yes. So I don't know if you remember much about this, but I do know that there are rotations that you will do. Most of them are like we call them rotations, but they're all like within our health oral health center on campus. But there is an opportunity for you to work with you have pediatrics patients who you work with, and then there's also a opportunity to work at the Center for Autism. Do you know more about that, Alicia?
Um, Not too much more, just that I know that that's an opportunity that's available to all DMD students. Um, They also do like give kids a smile every year, which is a pediatric population where a local school comes to the oral health center here on campus and gets, as a student, you get to sort of inform them on dental hygiene best practices and do mouth exams and things like that. And it's free of charge for them. So that's an experience that our students really enjoy as well. Let's see. Uh, Is coursework from Canada accepted?
Yes, so if you attended a primarily English speaking institution, then you won't need to get a WES evaluation. Otherwise, you would need to get that course by course evaluation, and then your coursework would be accepted.
Um, all right. I want to ask this question because I think it's pretty fun. Um, are there any like traditions or cool events within either like the CDM with the D.M.D students or even just like at UNE as an institution that you can think of that you'd like to speak to?
Oh, that's an interesting one, actually. Why suddenly I'm trying to think of all the events that we always go to and which one is the most interesting. Um, hmm,
I know I was gonna say like I just mentioned, like Give Kids a Smile is a really
hmm.
um big fun event that I forget what this past year, if it was like the third or fourth annual, but that's a new annual tradition that they've been doing, which students really, really enjoy. Um, yeah, I just had another example and it left my head. What did you
I
think?
don't know. Yeah, I don't know if it's like an event per se, but I think another unique aspect that a lot of students really like and gain value from is some of the work that you do in our interprofessional simulation innovation center. So there was a little bit on the video about that, but um, basically you go into a situation room and you have a high fidelity mannequin or sometimes patient actor come in and go through a series of medical events, typically a medical emergency. And so for dental students specifically, you actually, as a D.M.D., I believe, third year or fourth year, you will go into this simulation center along with dental hygiene students, and you will work together on, what do you do if a patient in your chair has a heart attack? What if they have a reaction to a medication? At first thought, you may think, oh, what does doing a simulation like this have to do with, dentistry specifically? But with that interprofessional focus, it's very important to be able to understand how to react if something happens and be able to understand like the larger scope of the practice and get that experience in a more safe practice setting so that way you will be prepared emotionally, physically, technologically speaking when you are out there working and something unfortunately may come up.
Yeah, definitely. The only other thing like I can really think of sort of speaking to like the service learning that we have happening here at UNE, there are like tons of opportunities available to you as a student to sort of get involved, even if it's for like a couple minutes. So there is an event that's held, I think, every semester where essentially, it's putting together like PB&J sandwiches to go to like an unhoused population here in Portland. So essentially, like we get a huge group of students, anyone who's available to make, I think like 1,000 sandwiches or something like that, and everyone sort of gets in like an assembly line, and it really takes maybe 5 minutes to make 1,000 sandwiches because everyone's in the groove and helping out. So that's like a really cool example of like a tradition and an opportunity that's sort of like a low lift, but it still makes a huge impact and you're able to get involved that way. All right. So being mindful of time, we might be able to ask like one or two more questions, but I think this one's really important. What do you think makes UNE's dental program unique from other dental schools?
I think a combination of a few things, but definitely the early exposure to hands-on work in the simulation lab, as well as early experience working with the patients directly, and the interprofessional model and how we approach the curriculum. Like I mentioned earlier, being able to work with dental hygiene students during an emergency situation, or being able to work with physician assistant and college of medicine students is a really unique opportunity that allows you to not only, learn from them in their scope of practice, but you also learn how to provide your knowledge that to to others in different programs. One um, thing that I really find interesting is in your third year as a DMD student, you actually work with our physician assistant students and College of Osteopathic Medicine students, and you actually show them how to apply fluoride and do head and neck exam evaluations. And so that's sort of your area that, you are the specialist in. And so you get to, show others that, and then, vice versa. And so I think that's a really unique aspect of the program. And then, yeah, just really, it's a very community driven campus as a whole, and DMD specifically. So um, you really have a lot of access to your professors, your colleagues, your faculty, and everyone's just very welcoming and open and really wants to help you. Everyone's very passionate on this campus about why they're here. And so I think that also makes it a very unique environment where people just like generally seem very happy when you walk by them, or you ask them about a class that they're in.
Yeah. Yeah, great answer. Um, all right. One more question. It's a little bit niche, but it might be helpful for some people. If someone took some classes like during a study abroad gap year, and that was transferred to their US institution's transcript, would they still need a WES evaluation?
So it depends if it's coursework. Typically, no, if it's a part of your transcript in your U.S. institution. If those courses are classes that you're counting toward a prerequisite, then we would need to get that evaluation so we could, um, you know, have that equivalency transferred.
All right, and now I think we have time for one more question. Um, So maybe we can make this sort of like a two-parter because I don't think we've really talked about like student success services that we have available. So the question is, are there qualities that can help students succeed in the sort of rigorous curriculum of being a DMD student? And then if you just want to talk a little bit about like some of the student resources that we have available.
Hmm. Yeah, a few things. So, one thing is definitely having coming in to transition to a graduate level program can, it's definitely a learning curve for everyone, just because oftentimes you may have to adjust the way you learn, the way you study, the way you manage your time. And so having a receptiveness to feedback and like that openness to maybe try a new study habit, or really just whatever it may be, having that I don't know what you would call it, that open-mindedness, I guess is the best term. Some of those skills, being able to be very willing to do what you need to do to best help yourself. I guess that makes sense. And of course, some of those other qualities, your empathy, your bedside manner. How are you with patients, but how are you, um, you know, how are you talking to them, explaining situations to them, and also just your overall ability to collaborate with others, and have, I don't know, that makes sense.
Yeah, yeah,
Yeah,
definitely.
okay. And then, so in terms of student support services, everything is graduate focused, which is great. So we do have a student academic success center, which is our um, tutoring workshop area where we have peer tutors who faculty have actually recommended to the Student Academic Success Center to either do, one-on-one tutoring. They do anything, or, small groups. They do anything from specific coursework tutoring, head and neck anatomy or anatomy. That's going to be a class that they definitely have a tutor for. Also, other more general things like research help, citing sources, writing papers, all of the like. They have that and really do encourage you to utilize those services. We also have a free, at no cost to you, student counseling services on campus as well. What am I missing? I'm missing one. We also have GAPS, that we call it, but it's our graduate professional um, affairs office, and they really handle everything for student support. So they run Stress Relief Week, and they bring pet therapy and a petting zoo to campus with a donkey and goats. They provide discounted tickets to the Red Sox games. Sometimes you can go down to Boston, local concerts, sporting events, really just food trucks on campus. So there really is a lot of graduate support on the campus.
Yeah, I would also say, I don't think you mentioned if you did, I'm sorry to repeat it, but the Oral Health Center has student tutors, upperclassmen tutors free of charge available in the OHC. I think like every day of the week for from I want to say like 5 to 9, and then maybe sometimes on Saturdays, which is really fantastic. Yeah, but I was gonna say, just being mindful of time. Thank you all so much for joining us tonight. Again, if you have any questions at all, please don't hesitate to reach out to Cassandra or the rest of our team, either through email or over the phone. We're happy to help. And that's really what we're here for. So, Cassandra, any last parting words?
Yeah, of course, please feel free to reach out to our office if you have any questions at all. I'm very excited to be working with some of you this cycle if you're applying, and if you're thinking of a future cycle, definitely keep in touch and, stay on top of connecting with us in case anything, shifts over the cycles. But I'm really excited that you all were able to join us today. And congratulations on starting your dental medicine journey. And I know the application process can seem daunting and a long process, but I just want to congratulate you all and just give some words of encouragement to the process. You can do it. You've made it this far. And if you have any questions, please feel free to reach out to me.
Awesome. Thank you, everyone. Bye.